everybody, I'm Stephanie. I'm an EMIM2. Thanks, Kelsey. My talk today is on SALT triage. So SALT triage was created as a way to quickly triage patients after a mass casualty incident and to also move them away from the site. There are 4 parts to the acronym. There's S for SORT, A for assess, L is for life-saving interventions, and T is for treatment and transport. So the first part is SORT. When you approach the scene, you are supposed to announce very loudly, if you are able to hear me and you're able to walk to this designated area. That'll quickly sort out the people who are more or less okay. They're able to follow commands, they're able to hear you, and they're able to move themselves. Whoever cannot walk, ask them to wave for help. Then you can see who is not mobile but are still following commands. And then the last group would be the people who are still / unresponsive. So the people who are still and unresponsive are an obvious life threat, so you would assess them first. The people who are waving or making any kind of purposeful movement, you assess them second. And then lastly, the people who are able to walk to the safe area would be addressed last. The third part of SALT is the assess. This is the individual assessment of each patient for any kind of life-saving interventions that you can do right then and there. So there's a couple parts to the life-saving interventions. First one is controlling major hemorrhage. So as part of SALT, you're only supposed to use whatever resources you have on you. Anything that requires you to go back to the area to grab more supplies should not be done immediately. It should be only things that you can do right then and there as you're moving through people. First one being controlling major hemorrhage. You can apply tourniquets, do direct pressure, ask the patient to hold pressure if they're able to, or use nearby objects to help you hold pressure as well. Next part is open airway. You are allowed to use basic airway adjuncts. There's no intubations while you're there. These include OPAs, NPAs, things that you have nearby as you go through everybody else. If they have a pneumothorax, you can consider a chest decompression. Also, part of SALT is auto-injector antidotes. This is mostly talking about sulfanogen, which is the antidote for cyanide poisoning, which can be used for major terrorist attacks. So this is a diagram. After you do any life-saving interventions, you assess if they are breathing or not after your intervention. If they are not, then they're dead, as part of the SALT. And then if they are breathing, you go down to the gray box. Are they obeying commands and making purposeful movements? Do they have a peripheral pulse? Are they in respiratory distress? And is the major hemorrhage controlled after you do your basic interventions? If all of these are yes, then you have to ask yourself if they have minor injuries only. A little bit of subjectivity to the SALT triage algorithm. If you say yes, then they're green, minimal. If it's no, not minor injuries, then they're delayed or yellow. If you can say no to any of the questions, you go down to the yellow box. Are they likely to survive given the current resources? Again, a bit of subjectivity. It depends on situation. If you say yes, then they are immediate or red. And if you say no, then it's gray, like this dark gray color, expectant. And just as a general point, all of these can change. It's important to, as you go through everybody the first time and you sort them the first time, to always reassess the people who are, yellow and green to see if they have moved to the red category or the expectant category. Lastly, for SALT, the T is for transport or treatment. The priorities are given based on how you categorize them. The immediate or the reds are addressed first or transported first, then the delayed group, which is the yellow group, then minimal, which is the green group. The expectant are given transport and treatment if time and resources permit. And then obviously the dead are last. Okay, so we're going to do a practice scenario. Let's say there's an active shooter at a sporting event. We have a 23-year-old female with GSW to right thigh. She doesn't have any other injuries. She's breathing spontaneously. She's not able to move her lower extremity. She does not have a palpable DP pulse. So when you go to the scene, you announce anybody who can walk to this area, walk to this designated safe area. She's not able to walk. She's waving you down for help. Okay, so first you sort. She will probably be assessed second because she's able to wave and make purposeful movement, but she's not walking. Then you do the individual assessment. Does she have major hemorrhage? If so, and in this situation, let's say she does, then you apply a tourniquet and the bleeding stops. Is she breathing? Yes. Is she having a peripheral pulse? No, she didn't have one before the tourniquet. She still doesn't have one now. The major hemorrhage is controlled. So then you would go down to, is she likely to survive during the current resources? Let's say yes, we'll deem her as red or immediate. She's one of the first people to be transported out. All right, so now we're all going to participate in a mock scenario. Around the room, there's 20 patients, and given the scenario, we're gonna all get up, walk around, and you're gonna write your answers like on your phone about what you think and how you would categorize each of these patients. The answers will be emailed out for time. Okay.
Sorry, just a quick question.
Yeah.
Peripheral pulse, is that like systemic circulation? For example, this one, I think we're thinking the patient just has a vascular injury.
Yeah.
So it could be either more like they don't have a pulse, like pulseless, versus they have a pulse.
Of course, it could be either one, but I mean, if they're gonna be black tag, they're gonna be black tag. They're not gonna get up, they're not gonna have anything. So I think that pulse is probably talking to like hypotension and not dead.
That's what.
But also lymph on the other side.
Yeah. So would this patient be, in your mind, a yellow versus?
No, they don't do red because they need to get an operation to fix that limb, or they're gonna lose them.
Okay, but like has peripheral pulse, it's like she has a normal radial pulse and just her pulse is down in the leg. I would probably answer that question as yes.
Right, but it could be either.
Okay, it can be either. So
because if you're hypotensive but still alive, then you still need to go to the hospital first.
Okay.
And if you have a leg that has no pulse, you need to get to the hospital first because you're going to lose your leg up.
Right. I mean,
so it's either one.
I know the implications of it, but I just mean in the purpose of the triage.
Right, but like I said, it'd be either one. They're still going to be tag red either way.
Okay.
Because they have to go. You cannot just do. I will say too that don't forget this is all for field triage. We probably wouldn't use this in the ED. This is meant for field triage by paramedics. You know, there is that chance that the doctor may be the triage person in the field if an event happens in front of you, but this is really used for field triage and not for the emergency.
Okay, so we're going to pretend we're in the field. The mock scenario is there is a gas line explosion in an apartment and there's also a fire. So you can get up, start with any number, they go around the room. Oh, and then this is, I put up the algorithm to help you guys.
And there are 20 pages. Go when you make your medicine. What's green? Green needs to go home. I'm doing great. Yeah, you're doing right. Oh, no, they put all the kids in the same place. It's all going on right now. I want to be. Yeah, okay. That sounds like Brett. He's not right. Brett. Hey, what happened to Dream? They go home? They can still go to like go back inside the building.
Let's find out later. Oh, yeah. That's why I tried to start from the
okay.
backwards, whatever. I'm gonna do
Yeah. Good. Good. Yeah.
Oh no, are we missing?
Well, I don't know. I might have. Well, you. What am I- that's the point of it.
Yeah, then if you have the answers, you could, is it easy to pull them up or?
I don't know. I would have to email them. I don't know, whatever you guys want.
If we have time, then yeah, you can definitely do the answers now. Read them out loud.
Yeah, that's
Not like
Anything else, Clyde? Read it out. Read it out. And then we can do 5 to 10 minutes to like identify. Like, you weigh off and we can like go.
okay.
Okay, guys, two more minutes to select this one.
Really? Everyone's immediately.
Probably not.
All right. Guys, we're going to go over the answers, okay?
All right, guys, we're gonna get the answer. Let's see if you black text some of these.
Okay, so as you can tell, there's a lot of subjectivity, and some of these are, you know, it could be depending on the situation, so it's a little subjective of what you tag them. So we're just gonna go over together, and if there's like anything that this is what I've answered, there's anything that you like majorly disagree with, then we can talk about it. And then just see how many you get right. All right, the first one is the 27-year-old with the full body burns. He has like the soot in the oral pharynx and nares and has a respiratory rate of 40. Red. Cool. Second is the 54-year-old female, large parietal hematoma, eyes closed, nonverbal, also red. They're not all red, just so you know. Okay, number 3. That's fair. Yeah. All right, number 3, the 54-year-old with burns to the whole body. He has the soot in his nose, asking if he's going to die in extreme pain. I put him as red. You can't. You can't. Yeah, I've heard some people saying they had a C collar on them, which is fair. It's up to you what you carry with you. All right. Number 4. There is a 6-year-old female refusing to move, holding her head very still. She is yellow. All right, 5. This is a 33-year-old with a piece of the building stuck to her. She's able to walk. She's like limping with the block removed. She's green. Cool. 6, unknown age, young male, severe burns, no pulse, agonal breathing. He's dead. All right, 7 is the 81-year-old on Coumadin with the bleeding head wound. She's dizzy, but she's able to ambulate. She's green. All right, 8, 90-year-old on Coumadin. A little confused and answering questions. I put him as yellow. 8 is yellow. All right, 9. The crushed under debris. I put her as red. She's pale, diaphoretic, cap refills delayed. Could also be yellow. All right, 10. Decreased breath sounds on the right. I put red. 11. Bilateral hand numbness. Green. 12. The headache from the fall. Disoriented, not following commands. I put him as red. 13. The 55-year-old with the seizure after smoke inhalation. She's post-ictal. I put her to be yellow. All right, 14. 32-year-old male. Ambulatory. He is green. 15, 9-month-old male, crying inconsolably, no obvious trauma, yellow. Can't be green because you don't really know what's going on because he's a kid. That's what I think. Justified to myself. All righty. 16 is a 17-year-old female, states that she can't hear after the blast, but she's walking. So green. 17 is the 66-year-old male, history of COPD, saying the smoke is really bothering him, breathing at 25. I put him as yellow. 18, 86-year-old male, found face down in the pool of water, not breathing, he's dead. 19, 25-year-old female, jumping from the 5th story, crush injuries to both legs, she has crepitus to left chest. I put her as red. And then lastly, the 38-year-old male, jumping from the 2nd floor, with a deformity, but he has a pulse, he's yellow. Is there any that you guys were like, why would you put them as this? Or you guys want to talk about?
No, 2. You did 2 blocks.
For dead, yeah, I had 18 and 6.
Because I like, 5-story fall, like massive like injuries, obviously out of cam. If I got to decide who's kind of not that person.
That's fair.
What was number 3? Yeah, black 3.
3 is red.
No, I
Oh, you black 3. 54-year-old male, burns the entire body, unable to ambulate, can't assess cap refill due to the burns. He has soot in his nares, complaining of pain, begging for pain meds, asking these
I guess for me, that's thinking about long-term prognosis.
Yeah.
So maybe that's not the point. Maybe we're using our doctor hat. 100%. I mean, I think what's clear is that your bias is going to be part
Yeah.
of it. It's hard not to be biased. And I mean, for me, in thinking about it too, and what Stephanie said too, is constant reassessment and seeing what resources you have. Maybe someone will be a yellow, but if you have another bus, like, okay, you'd be red now, you go.
So I think people in triage, they like actually think about the outputs that they're transporting to, or like what they have, or
Yeah, that's a good question. It's not part of the SALT, but something that would obviously help you discern what resources permit if your area does not like a burn center or anything that might influence what you tag them. Yeah, but as you can see, it's very subjective. And depending on what you guys think resources we have or whatever hospital resources there are, then you can tag them appropriately. Awesome, that's all I have. Thank you.